Good evening. My name is Shweta Patro. Thank you so much for coming to my presentation. Today I'm going to be presenting on solving the prison mental health crisis through a new technology called telepsychiatry. So the problem we're really addressing here is the problem of mental illness. And mental illness is pretty widespread and very undertreated. And the incidence of mental illness, particularly serious mental illness, among prisoners is considerably higher than that of the normal population. Whereas 1 in 4 people have psychiatric disorders in the normal population, about 1 in every 2 people, or even more than that, have psychiatric disorders within prisons. So mental health disorders pose a pretty significant threat to the optimal health of these subjugated inmates. What I'd like to explore here is how we can correct this disparity with the use of technology. To get started, I'll first be going over the deep disparities that exist in the prison psychiatric care in the areas of cost, access, and quality. Then I'll run through the improvements that a telepsychiatry intervention would make in each of these areas. Since the first half of the 20th century, mental health care in prisons has been increasingly privatized due to the profit-driven fulfillment of psychiatric needs. This system doesn't work in the context of correctional facilities where wardens and sheriffs have very little interest in the quality of life or long-term survival of inmates. Correctional facilities using private healthcare providers are routinely understaffed and often mandate the use of the least expensive treatment without regard to relative benefit. These policies often lead to uninformed and unethically subpar psychiatric care for prisoners. One example of this lack of quality is the use of solitary confinement as a healthcare treatment for prisoners. The lack of human contact actually increases aggressive behaviors in those with serious mental illnesses. Still, more than 75% of the mentally ill in prisons get placed in solitary confinement. Now let's see how telepsychiatry can improve the quality of care in prisons. Telepsychiatry allows prisoners to get therapy that is much more tailored to each individual. Instead of solitary confinement, a course of antipsychotics along with a regular appointment with a therapist might be used to manage an unruly and mentally ill patient. In addition, since therapists can choose their own hours through telepsychiatry, they aren't pressed for time, which allows them to give really attentive care to patients whose society has really systematically ignored, and these are the patients who really need care the most. The next disparity I'd like to show you is the disparity in the area of access to mental health care in prisons. The care for prisoners in correctional facilities is markedly worse than the care in community mental health clinics due to a set of very ugly, unrecognized biases against the human rights of prisoners called structural inequalities. And these structural inequalities trap people of color and other minorities in circumstances of imprisonment. This is especially the case if they abuse substances or are otherwise mentally ill. They're far more likely to end up in jail. Security protocol also often delays or prevents prisoners from getting the care they need. And lastly, I just want to point to your attention this map of all of the mental health professional shortage areas in the United States. Those shortage areas, also termed HPSAs, are highlighted in green, so that's most of the United States. And there's a shortage of healthcare providers in those areas already, so you can bet that the correctional facilities in those regions don't have very good mental health care services. Access, while it may be limited by many things, can actually be expanded through telepsychiatry. So the orange dots on this map on the screen show that the prisons using telepsychiatry programs in the United States right now, as you can see, there are quite a few of them. In the places that these programs have been implemented, they've actually increased access to care both in and out of the prison system through carefully coordinated release planning. Release planning is the counseling of prisoners for reentry into society, and when combined with telepsychiatry, this type of program can lead to better outcomes. So this form of release planning actually provides mental health care with the option for prescriptions and follow-up treatment, mostly through telepsychiatry, and upon exit of the prison system, has shown to lead to lower rates of recidivism, meaning prisoners are less likely to re-enter the system once they've gone through a release planning and telepsychiatry program. The last area of disparity I'd like to talk about is the cost of mental health care in prisons. A recent study showed that that treating mentally ill prisoners is about 20 times more costly than treating mentally ill civilians. And one of the reasons is because the costs are skyrocketing is due to the transportation and security costs involved. Often consultations required hiring extra armed guards, maybe armored vehicles, and depending on the security level of the prisoner, maybe even changing traffic flows. As you can see, the cost of video conferencing actually levels off at a certain point, whereas the cost of traditional therapy keeps increasing as episodes of mental illness and as consultations keep increasing. Telepsychiatry allows prison facilities to cut down on the astronomical costs involved in secure medical transport for prisoners, and instead of draining resources on expensive specialty emergency care, facilities can save on security, transportation, and diagnosis costs. Many prisons are located in medically underserved areas, as you saw in earlier slides, and more than 1 hour away from a hospital with a qualified trauma response unit. So given that mental health crises like psychotic breaks, severe manic episodes, etc., often require immediate attention, that difference in time of diagnosis and treatment is pretty significant. In addition to ease of access, telepsychiatrists can also prescribe medication during video consultations. So given that prisons, even federal ones or large state facilities, don't have prescribing physicians on site, this enables treatment in a timely fashion. On a more positive note, mental health treatment often spreads itself around when employed in social settings, sort of has a positive halo effect, which saves on cost even more. A company called Insight Telepsychiatry actually did a calculation of the cost of an evaluation for someone treated with telepsychiatry and someone treated without telepsychiatry in a prison, and they found a saving per use of about $5,000, $5,067 to be exact. which is a considerable amount per person, especially when you consider that the federal government has time and time again cut funding to prisons. To make a long story short, we can see here that telepsychiatry can help improve quality, expand access, and lower cost of mental health care in prisons. Now that we've firmly established telepsychiatry's benefit, I'd like to guide you through my proposal to implement telepsychiatry at the Federal Corrections Institute in Berlin, New Hampshire. Now, FCI Berlin might seem like a bit of a non sequitur choice for a pilot program, but in fact, it's been the laboratory and birthplace of many wildly successful and widely implemented programs across the United States prison system. One of the reasons for Berlin's success is actually sitting in the audience today. I'm delighted to have Dr. Deborah Schult, the warden of FCI Berlin and the Assistant Director of Health Services for the Federal Prisons Bureau, listening into this presentation. Thanks for being here. I'd like to spend my remaining time outlining my plan for the implementation at FCI Berlin, as well as the budget and next steps if the plan is approved. The initial step of the program would be to pick a random cell block. Each block consists of about 20 inmates, and take baseline measurements of quality, access, and cost before the pilot program even begins. So these are just example measures, but I'd like to stick to one measure per category just to keep the measurement consistent and straightforward. So an example of a quality measure might be how many inmates are given therapy or prescribed psychiatric medication, and this is assuming that needs are unmet. We should see an increase in prescribed medication or inmates given therapy. An example for access might be how much time does it take for inmates to get therapy or medication. This timing should decrease if the intervention is successful. And for cost, we might measure how much a typical psychiatric consultation costs per patient. This measure should also decrease, similar to the time question for access. The next step is the actual implementation of the program. The cell block chosen will be outfitted with a computer, video chatting software, a platform called Insight Telepsychiatry, which is an inexpensive and popular platform for telepsychiatry in correctional facilities, as well as a private Ethernet internet connection. We will also be arranging for a team of psychiatrists inside the same state. We'll also use Insight Telepsychiatry and the same software and have the same software and hardware capabilities to be on call. There will be one psychiatrist per consultation, but these psychiatrists will be alerted that they are being part of a study. Quality access and cost measures are going to be recorded by prison guards at every consultation, and inmates are able to request consults with psychiatrists whenever they'd like for any purpose. So once the measurements are taken, we should see corresponding increases or decreases. So increases in quality, increases in access, and decreases in cost. And to ensure that there's fair measurement, these measurements will be taken over about a 30-day period. Okay, so moving on to budget. Each inmate If there are 20 inmates, would need about an hour each per week. And each prison guard would be paid $20 per inmate as a flat fee throughout the entire trial period. This telepsychiatry platform software should cost about $100 through Insight Telepsychiatry. The computer with the flat screen monitor should cost about $200. Camera and speakers together should be about $100, and the installation and proofing of the hardware, so installing the camera, computer, and speakers, as well as the internet connection to make sure that it isn't harmful or potentially dangerous to prisoners, that would cost about $100 in labor. So this is a further breakdown of the budget. As you can see, the psychiatrist consultations will probably cost the most. This is, I should note, an estimation for a week of a trial period. But as I mentioned earlier, the entire trial period will be for 30 days. So after this week, that would be the initial trial period, and then we could go into a deeper pilot program trial period of 30 days if we like the measures, because I know that this entire plan is a bit expensive, and I want to make sure that you get your money's worth if you do decide to invest money in this. So the next steps, if this is successful, is to implement the same procedure across the entire prisons. Make sure that every cell block has their own video conferencing system for telepsychiatry and for healthcare use. And this time the measurement period would be over at least 6 months so that we could get a better sample. And possibly there could be implementation in similar correctional settings, maybe minimal security federal prisons. Okay, that's about it. If there are any questions or comments, I would love to answer them. Thank you so much for attending my presentation, and I hope we can work together to use this technology to improve psychiatric care in correctional facilities, starting with FCI Berlin. Thanks.